My name is Atanga Saktoa. I'm 23 years old and I live in Tendere C.
My name is Elizabeth Smakampa. I live in Tendere East. I'm 28 years.
My name is Charles Nkunde. I live in Tendere B section. I'm 23 years old.
My name is Siwa Wenti Mubiana and I live in PHI.
So in Zinayanga, in a very lawyer, Ningala ku section D, kumtendere side.
I know that ARVs are antiretroviral drugs.
ARVs are drugs which people take when they have HIV and AIDS.
I just know that they are medicines for if you are positive.
The initials, I don't know them like that much, but what I know is they are meant to weaken the virus, the HIV and AIDS virus, for you like to give your body a proper functioning. Yeah.
My ARVs are seven through PEP. Kan sukumwa vija vintu, sumankale yote.
PreP.
PEP. I've heard about it. Yeah, and to my knowledge, what I know is it's something you drink if you want to avoid like being exposed to certain diseases as AIDS. Yeah.
There are drugs. I don't know what they stand for, but I only know that there are drugs given to people. Let's say maybe you had a situation where you were involved in some rape or anything, and then they give you that at the hospital to prevent you from catching the virus.
The one thing I know is that you take them if you're not positive. I'm not sure if that's true.
PEP. That one, no. I have no idea.
No, I don't.
Okay.
That one I will lie. I don't know about it.
So my name is Brian Habanji. I'm a pharmacist by profession, and I'm currently working at the University Teaching Hospital, in particular the Adult Infectious Disease Center of Excellency, where we handle quite a lot of infections. ARVs, the letters ARVs stand for antiretrovirals, or really antiretroviral drugs. Sometimes we call it ART, which is antiretroviral therapy. So these are drugs that we use for the management of HIV and AIDS. So when one tests positive for HIV, of course now the national guidelines suggest that when one tests positive, you start treatment immediately, because the benefits of starting treatment immediately or quite early are huge and vast. And so ARVs are drugs that we use for treatment or management of HIV. You'd wish to quickly know that ARVs are a lifelong therapy. There's really no point that one should say, I think now I can stop, at least for now. The most important thing about ART is that one must be committed to taking these drugs. That's what we call adherence. One must stick to the treatment, how he's been advised or how she's been advised to take by the healthcare workers to improve the outcomes. So the letters PreP stand for pre-exposure prophylaxis. Pre to mean before, exposure to mean when one gets exposed to the virus. In this case, we are talking about the HIV virus. So these are drugs that we use to prevent HIV infection in one who has not yet been exposed. And of course there are many things to consider before that, but there are people that are at substantial risk of getting infected. And so while they are yet to engage in that risky activity, there are some drugs that one can be put on that will prevent acquisition. So basically that's PreP. Number two, it's what we are calling PEP. And so PEP is post-exposure. So after one is exposed to the virus, at least 72 hours after exposure, one has to be put on these same ARVs for them to prevent the acquisition of the virus. And so both PreP and PreP are really initiatives or interventions that help prevent acquisition of the virus in people that are not HIV infected. Where can one access PEP? Choose your nearest health facility. As long as it runs an ART clinic or an HIV clinic, they should be able to talk to you and give you further details on PrEP and PrEP. That should be about it.